So hello everyone, and welcome to the ICFJ Global Health Crisis Reporting Forum. And my name is Paul Adepoju, and I'm really glad to have you on today's webinar, which is on a very key issue, which is looking at the connection between obesity and the COVID-19 pandemic. Quick background, several weeks ago in March, the World Obesity Day was celebrated, and a report was released on this particular day that showed that individuals with obesity are 10 times have a 10 times higher chance of dying from COVID-19 than individuals who are not obese. And these reports actually resonated globally and called attention to the importance of committing more resources, committing more time, being more serious, being more intentional about addressing issues that has to do with overweight and obesity. But while obesity and overweight are accepted as a major problem, global response to this development, to these issues, has not been the same across board. While we have countries that are at the forefront of combating obesity, even at the local level, by intentionally promoting and supporting local entrepreneurs that are producing and marketing healthy products. We actually have countries that the producers of products that are driving the local obesity epidemic in these countries, where these companies are more influential, more powerful, and are seen as more critical to local economies than their healthy options. And so that is where we are globally. And reporting obesity to and overweight for journalists in different parts of the world could actually be tricky, especially if you don't know the right terminologies to use, if you don't know the people to talk to and what the key issues are. And that is why today we are deciding to put attention, to put the focus on talking about obesity. And we have an expert who is vast, not just in obesity, but in non-communicable diseases, and will be helping us to see the connections between these issues and how they affect global health during the pandemic and post-pandemic. So I'm talking about Johanna Ralston, who is the CEO of the World Obesity Federation. How are you doing today, Johanna? Thanks for joining us.
Thanks. I'm doing really well, Paul. I'm so happy to be here. It's an honor and a privilege. So thank you.
So we are really happy to be having you. And before we go into Johanna's presentation, I would like to notify you that if you are joining us on the Facebook live stream, please put your questions below in the chat space available on Facebook. And if you are with us today via Zoom, please use the Q&A chat option to put up your questions. And at the right time, I'm going to put these questions together, and we are going to have an extensive and thorough discussion with Johanna. So without much ado, I would like us to have a brief presentation by Johanna looking at obesity, where it stands in the world, and the key issues that we consider to be relevant for journalists. Johanna, can we project your slides and so that we can have that presentation right away?
Sure. Thank you so much, Paul. It's truly a pleasure to be here. And let me just get this organized so that this starts into slideshow. Great. So again, as Paul said, I'm Johanna Ralston. I'm CEO of World Obesity Federation. And I've been working in the area of non-communicable diseases, NCDs, for more than 20 years globally, and actually feel that the role of journalists in accurately covering and telling the stories is incredibly, incredibly important. So it's truly, truly an honor, and I hope the first of many opportunities to be working with ICFJ and to be speaking with many of you today. As you probably know, non-communicable diseases, NCDs, have surpassed all other causes of death and did quite a while ago. NCDs include cancer, diabetes, cardiovascular disease, and chronic respiratory diseases, as well as other, diseases that affect smaller portions. But essentially, those are the main four, driven by unhealthy diets, physical inactivity, tobacco, and harmful use of alcohol, among other things, just broadly. So I'm going to tell you a bit today about obesity globally. I did a couple of slides on Africa because Paul and I had a really wonderful conversation around the time of World Obesity Day about obesity in Africa. And I think it's got some interesting, unique issues, and also is a story that's really unfolding before our eyes. And so I hope more people are focused on that story. We're also in the middle of this year of a food systems summit that is a big UN event that will take place in September in New York. And it's focused on malnutrition in all its forms. And again, that does include overweight and obesity alongside undernutrition, which is a big challenge in many countries, low and middle income countries. So we'll also speak about COVID and obesity. I'll tell you a bit about my organization at the end, and then we'll talk. And I really am looking forward to a discussion with all of you who are here with us today on Facebook. Thank you again for joining. So some basic facts: about 800 million adults and children are currently living with obesity. We don't say obese people, we say living with obesity, to try to really reinforce that it's a risk factor and a disease. It's you don't say, whatever, it's showing that it's something, that there is a person besides the disease. I'll tell you a little bit about that at the end. So again, about 150 million children, and the rates of obesity among children are continuing to grow and are very alarming. So it's really important that we address this. Worldwide obesity has nearly tripled since 1975 and has actually increased, I think, tenfold among children in the last, since the 1970s. Between 1975 and 2016, children living with obesity grew over to 18% of the population. And that having obesity as a child definitely makes it much more likely that you will have obesity in adulthood. And global obesity prevalence is expected to reach, just in 4 more years, 18% in men, and more than 1/5 of women will actually have obesity. I should say also, that number doesn't include overweight. So overweight is a body mass index, BMI, of between 25 and 30, and obesity is 30 and above. So overweight is those numbers are even sort of double this. The overweight challenge, and overweight leads to obesity, just shows that this is growing. So if you want to look just quickly along the time frames, if we look from 1980, 2000, and now, the numbers, and all the numbers in all the countries in gray here are countries for which there just wasn't data collected, or there just wasn't enough of anything meaningful to be collectible. But that shows that there was certainly, obesity was becoming a real challenge in the US and in Finland, actually, and other countries, but it wasn't really being measured systematically. 20 years later, there was seriously a problem growing. And then now we look at, and this is among women, this figures, we look at the fact that it's not just growing, but it's growing everywhere. And that it's come to many parts of Africa and Asia. And so it's really a growing challenge. These are similar figures for men. There's not really that much different, but it's also helpful to see there are more women than men in Africa and in the Gulf region in particular with obesity. So that's one reason that we separate them out. And then if you look at young girls, children, or women under 18, you could say, these are the numbers here, showing that, again, very little sort of overweight or obesity. So BMI, you measure childhood obesity differently, but overweight or obesity was not a really big issue, which is, 40 years ago now, but how much it's grown, and grown widely. So, and same thing with boys. So I think we can establish, and then just, this is a graph that's kind of helpful, which shows a lot of sort of the obesity prevalence rates are in the 28s, 30, that's, quite high, or numbers of people living with obesity, sort of number of people living with obesity, I should say, is quite significant. In the US, it's enormous. It's approaching 100 million. But then you look down at the lower right, if you look at the Pacific Islands, you have prevalence of obesity, so percentage of the population living with obesity. While it's, in the US, it's 36, down in the many of the Pacific Islands, it's generally around 50%. So again, highest rates of obesity are in the small island developing states, the Caribbean, the Pacific Islands, and then also in places like the Gulf, as well as US, UK, Mexico, and a few of these other countries here. Countries with the most rapid rise, though, to show that those countries that are not showing still probably relatively low obesity rates are increasing. So obesity may be leveling off somewhat in the higher, heavier countries, if you will, but it's growing in places that currently do not have a high obesity rate, and that's listed here. They are generally in Asia and Africa. But we've done some projections looking at both the increase in obesity over the next sort of 30, 40 years, and the economic impact of that as a percentage of GDP, and it's quite high. So it's very much, why do we have an obesity epidemic? Just simply, it's very complex, but soft drinks play a role. This increase in sugar sweetened beverages and their wide availability. Certainly there are places in the world where you cannot get clean water, but you can get soft drinks, which is, that's a really important point. For some people, it's their beverage. Physical inactivity, which has grown as we've become more urbanized. Genetics plays a huge role, much bigger role than people understand. And certainly the genetics of your mother when she's pregnant with you matter, just as does her eating, in terms of if you're going to be predisposed to obesity. Diseases and drugs can be associated with obesity. Some of them it's a side effect, and stress contributes to it. Ultra-processed food, such as we see here. On the top, you see normal, non-processed food. On the bottom, you see apple, mango flavored popsicles, but there's no mango in them. There's no food in them. There's just chemicals. Fruit Loops, which are not actually anything to do with fruit. Meat products, which don't have much resemblance to actual animal, and soda. So these are some things that have contributed to it. This growth in portion sizes. Food has gotten cheaper and over the years, and there's just greater availability of it. But ultra-processed foods, again, there's different unprocessed foods. It's fine to have, if we cook, you process food essentially, but it's ultra-processed foods that's really driving a lot of this. And the foods, it's generous to even call them food. What works, some of the things that work we'll tell you about are things like labeling, these things that show high in sugar, high in calories, changing packaging, for example. As has been done with sugary cereals in Latin America. They went from having this very child-friendly image to no image, which just helps children to be less demanding of it. These are some things that work. Understanding this as obesity through the life course and what's called the obesogenic environment. But for World Obesity Federation, what we tried to do was really to think of obesity as a plant, and that has lots of roots. And food is very much one of them, but it's not the only one. There's stigma, there's genetic risk, there's lack of sleep plays a big role, biology plays a role, marketing, how heavily you're marketed to, access to healthcare. Does your doctor understand that excess weight is unhealthy? Not necessarily. There's so many different drivers of it. If we look in Africa, for example, there's certainly high rates of obesity, particularly South African has some of the highest rates among women in the world, 41% you can see here. And countries where it's growing, and then you see on the bottom the lower rates, places where it's low now, but actually was on that list showing what's growing quickly. A little bit more about obesity in Africa, just to say that the countries, half of the fastest rising countries with adult obesity are in Africa. Obesity also has a strong gender component in many African countries, and comorbidities, which we would mean diabetes, cancer, et cetera, are also on the rise. We very much know diabetes is a very significant problem. So too is hypertension. African countries have some of the highest levels of hypertension in the world. Much related to much of this is the changing diet, the changing availability of food, particularly as you move into cities. And some of the challenges too, just lack of access to affordable, desirable, healthy food. And junk food is marketed cheaply. And also there's been this sort of replacement of healthy crops and sovereign crops in many countries with, being agribusiness, which sort of buys up the land and produces these cheap crops that contribute to high red meat consumption, high sugar, et cetera. So, but now we're going to go to COVID. So what happened was very interesting. You know, in the past 15 months, our lives have all changed. One thing we realized very quickly was not that that obesity was causing COVID, although, you know, maybe someday we'll find out there's a relationship, but really that people with particularly severe obesity, so people at the higher end of the body mass index, were suffering terribly from COVID and much more likely to die. So we issued a report on that this year. It's not that when you have your population is at 48%, it's low, and when it's at, you know, then it goes, you know, all of a sudden it goes up one day. But it's this broadly just showed that the countries with the 10 lowest rates of COVID death were all low in obesity, except with one exception. The countries with the 10 highest rates were all high in obesity. So there was clearly a connection. What could it be? We don't fully understand yet, but we know that this shows some of the factors that are driving this. But clearly that when you have obesity, when you're carrying a lot of excess weight, first of all, you probably have comorbidities. You probably have diabetes and hypertension, and those are all going to work together to make you less healthy and less able to fight off a virus. But also you have an inflammatory response, essentially, that's putting you just much more likely to have a very bad outcome. So again, when we did this report, which was launched on March 4th, now we have more than 3 million deaths. But at the time, in the end of February, sadly, I mean, it's been 1 million since. It's been, you know, more than 500,000 since then. 2.5 million had died. 2.2 million were countries. We're not saying they were all had overweight or obesity, but they were in countries where there was high rates. So what does that mean? What's going on? Well, we know that also means that they're likely, even if they don't have obesity themselves, countries with high rates of obesity have high rates of heart disease, have high rates of cancer. If we look at the countries with the 10 lowest deaths per 100,000, they also had, you can see the third column here, they also had in the fourth column, low rates of adults being overweight, with the exception of New Zealand and Papua New Guinea. In the 10 countries with the highest rates, US, UK, Belgium, Montenegro, mostly just Europe and US, plus Mexico, I think, is number 11. They all had high rates of obesity, high rates of COVID death. But what about New Zealand, Iceland, and Cuba, countries with high rates of obesity, but not high rates of COVID death? We think it's probably because they're small island states and we're able to close their borders. And as small island states, it's easier when government tells you to do something to do it. It's not as sort of unruly as some larger countries are. So wider impacts have strained food systems and supply chain. There's been a lot of unhealthy marketing, reduced opportunities to be physically active. So people who are on the border of being obese or having obesity crossed that border also during lockdown. So there's been a lot of different factors that have contributed to this. Increase in eating unhealthy food, being marketed to not being able to get health care. Recommendations for ways to treat this include public health approaches, but also, working in the health system to try to get help for this. If we look at the WHO manifesto for a healthy and green COVID recovery, which they came out with about a year ago, everything here is also good for obesity. So that's an important point. Walkable cities, stop subsidizing fossil fuels that cause pollution and drive climate change. Climate change contributes to our unhealthy food systems. So just now to close out, and now I'm really looking forward to hearing from you. At World Obesity Federation, we are oriented around WHO and UN targets on obesity. Now, over the past, obesity has been understood as a problem for quite a while, but no one's known quite what to do about it. And we still don't have the perfect formula. But WHO and the UN passed targets, global targets, saying no increase in adult and childhood obesity prevalence. This was a target that was passed in 2013. There's also, a UN target around ending malnutrition in all its forms. It's not being reached. And so therefore, we at World Obesity are saying we need to take the complexity of obesity and communicate that the roots of obesity that are driving, we're going to communicate into a clear map forward, which we call roots, which is about recognizing obesity as a risk factor in a disease. That's the R. The O is obesity monitoring and surveillance. The second O is obesity through the life course. That means childhood and adulthood obesity. T is about treatment, understanding that some people have obesity and we need to treat them in the primary care system or in the more secondary and tertiary care. And systems, food systems, health systems, urban systems, transportation systems. So what we've tried to do is say we're not going to tackle obesity by doing one thing. We have to do 5 things, or we have to do many things at the same time. and they all fit into this root strategy. On World Obesity Day, I just wanted to mention, when we issued this report, what we were shocked by was how much enormous coverage there was on the day. So this link between COVID and obesity, which we know is associated with, again, how unhealthy people with obesity, severe obesity, actually are. Huge reach on the day itself. And interestingly, Boris Johnson launched a £100 million budget in the UK government to address obesity. Now, actually, states and cities in the UK are looking for ways to spend this money that they have to spend. And it was really in recognition that Boris himself, this is important, has obesity or had it. He got COVID. He was very sick, and he understands now what it means, and he has therefore made this a priority. And there's actually many political leaders who are carrying extra weight, and I think who are going to be more attentive if you're trying to reach people. So we work through these different reports. And again, we ask you to come to our website, www.worldobesity.org. And we have this report on obesity of missing the targets for adults and children, which came out in March 2020, showing those targets that I showed you earlier for the WHO and the UN. We're not missing, we're doing terrible on, and we need to do much more. We were saying that for a long time, and then COVID happened and showed what the consequences are of not doing something about obesity. So it was a perfect storm where we're able to get more attention. The Atlas of Childhood Obesity, which also shows how we're doing in terms of children, which again is also not good. We're doing a terrible job globally. And each of these includes report cards for every country in the world. So you as journalists can go to these and find a report card on your country on how they're doing. What are the particular drivers of obesity in your country or your countries that you're focused on, and then look at the resources that can help. And then finally, again, the 2021 Atlas, which I think shows in very concrete terms how many people are dying. And what I would say is, now that we've looked, that's looking backwards. But if we look ahead to preparing for the next pandemic, which I think we have to live in a world where we are, we couldn't have stopped the pandemic by addressing obesity. We could have stopped a lot of people dying and a lot of the economic toll that happened from having to close down so that healthcare systems wouldn't be overwhelmed. Meaning that next time we need to get our arms around this and really do something about overweight and obesity worldwide. Sorry, I just went backwards. Also, this is a report that's coming out soon that will provide additional tools, and it will soon have information for every country in the world, again, on the World Obesity website, which shows we're piloting it in the 8 countries listed here: Brazil, Mexico, Thailand, South Africa, India, Australia, Saudi, and Spain. But we are looking at what is the impact on gross domestic GDP of obesity, of the hospitalizations, of the health costs, of the lost productivity. So that helps to support investment in just what the UK has done, obesity prevention, and people who already have obesity not managing this. So we also have lots of stories from our global community, and I think obviously we know stories matter. These are on the World Obesity Day website, but we also have them in the regular website. So the person telling that story can be very powerful. My last point, and then I want to hear from all of you, is it's very important to not use stigmatizing language. One of the issues is that I think initially people understood overweight and obesity as just a sign of weakness or laziness. Now we know there's a much more complex genetic storm behind it. And we know that things like the food that people have availability to, which the poorer people are, the cheaper the food is. And then that means that the less healthy it often is, unfortunately. There's many drivers, and yet we portray people with obesity as bringing this on themselves. We don't even show their face. It's just this very anonymous, judgmental picture. And we say, and so we want to encourage people to also use language that, to use positive images of people with obesity, showing we're all in this family together, and many of us in fact have overweight or obesity, and sort of positive messages. And then also should say people with obesity rather than obese people, suffer from obesity. It's better to say have obesity. So and not having these photos of people eating unhealthy food. So that's that, and I'm going to stop sharing now so that Paul and I can talk. Thank you very much.
Yeah, so thank you very much for that eye-opening introduction that really sets the ground for a lot of conversations on the issues of obesity in different parts of the world. So I'd like to start with the complexity of obesity itself. And do you think the definition of obesity outside what the WHO and international health organizations define as obesity. How do you think individual countries or cultural perspective of obesity, how does these elements impact local response to obesity?
Well, so I think you're getting at a really interesting question, which is how different countries perceive excess weight. And so I think with a definition of obesity, besides classifying it from BMI, we have to think of it as unhealthy weight. It's about unhealthy weight. In many countries, and some of the countries I was showing, like the Pacific Islands, there has traditionally been a really positive view of excess weight, of the, it means that you're wealthy. It's seen as attractive, it's seen as sexy, and that's fine. I mean, I think nobody here wants to say a big body cannot be a beautiful body at all. But we do know that overweight and obesity dramatically increase your risk of cardiovascular disease, of cancer, of diabetes, and those are problems. So we just want to focus on unhealthy weight. So I think different countries, you have to tailor the messages based on local attitudes. Although it's interesting because we have a new stigma working group at the World Obesity Federation that includes people from all over the world. And one thing we're hearing is that the younger generations are not as big fans of the bigger weight. They tend to be more following the ideal is more and more becoming that more Western model, for lack of a better term, of a thinner body being more preferable. But it's really important to understand what the cultural attitudes are, definitely about overweight and obesity.
Now, okay, so one of the issues that comes to mind when I talk about obesity or when I report on obesity or any other health issue is the access to available data sets. And in making these interpretation, making the conclusion that COVID-19, people that have obesity are 10 times, the chance of dying from COVID-19 is 10 times higher in them. So how did access to data impact this particular conclusion? And why do you think in some countries, because I went through the report myself and I saw that some countries, inferences were made based on data sets that were produced in 2016, 2017, not latest data. So how do you think these actually impact obesity control measures?
So the availability of data, I think it's an incredibly important question because I think obesity hasn't really been understood as well as other things as a disease, is what I would say. It doesn't get, so there's the global burden of disease, which measures a lot of, that's what we use to understand a lot of disease burden. They don't describe obesity as a disease, although the World Health Organization does. They just think of it they just describe it as a risk factor for other diseases. So you wind up getting there's not a really great accurate picture of obesity. So like anything that's kind of, we're still building the science around and building the evidence around, you have to just kind of trust good estimates that have had a lot of rigor. But we at the World Obesity Federation, we have the Global Obesity Observatory, which includes data, the best possible data from every country in the world. Now we try to use measured data, but we also use estimates where measured data are not available. So I think it's, but we do hope that global burden of disease will start to really list obesity as a disease, because then that I think will show countries how serious a problem this is in a ways that they're just not doing right now. But a lot of countries do report on BMI, not in a standard way, and that's helpful. At least it's something. It's good. It's not perfect. So, but data is never perfect.
Yeah. Of course. Of course. Then still on the issue of data, many the BMI is the standard, is the most popular way of measuring or determining whether somebody is obese or not. But we have a question that asks about why do we still rely on BMI as an indicator of health, or what person is obese or not, when it is based only on the height and weight of a person. It has been claimed to be an inaccurate measure of body fat content and does not take into account muscle mass, bone density, overall body composition, and racial and sex difference, according to some research. So what is your take on this?
It's absolutely, well, I wouldn't say it's not inaccurate. It's just imperfect. It's very imperfect, but it is simple enough to do. And so it's a place to start, but it's a kind of lowest common denominator. There are definitely other, so one example, I guess, is if you're a very fit rugby player, you could still have a BMI that looks, that would call you obese or say that you have obesity, but you're actually really healthy, your heart's healthy, you're just big and you have a lot of muscle mass. Arnold Schwarzenegger, I don't think has a BMI that would make him obese, but some athletes do have so much muscle mass that they would be, if you just used BMI, they would be, you'd get an inaccurate picture of their health and of their state. So I think it's BMI. It needs to be, what we need to move into is BMI plus probably one or two other measures. It's just that there's not really complete agreement on what those should be. There's things like hip waist ratio. There's differences in India. There tends to be more of the adiposity sitting around the middle section than in other countries. So there needs to be a measure that would work in different cultures and different countries with sometimes different kind of physical, average physical types. So yeah.
Yes,
But
still on the
BMI
issue
is good though. BMI is good. It's just not enough at all. Okay.
of course, I agree with you.
Yeah.
Still, because I think the approach would be something, having something instead of having nothing, would be the implication. Then still on data, maybe one of the last questions on data, we have another question that says much of the country data used to compare COVID-19 death rates and the correlation with obesity are places where data is underreported or not reported for a while. How can this data be reliable for making these connections, and how do we deal with issues such as obesity that may be stemming from them, but you can't see because of unreliable data? So what role does data play in combating obesity? I don't know whether I
Sorry,
got all that.
can you repeat the first part of that question? I don't think I fully understood the.
Okay, the first question says that the first part of the question says, how do you deal with issues such as obesity that may be stemming from unavailable, underreported, or unavailable, or long lack of latest data? And what role does data play in combating obesity?
Mhm. No, I think that's important. I think that I mean, as I said, I think I don't actually think data is very much a problem, lack of good data. And you will see if you visit our Global Obesity Observatory that we have really tons of data for some countries, and they tend to be more in Europe and the US and high income countries, and much less for other countries. But I do think that there's different, we also use multiple data sources to see, are there good proxy measures, including diabetes, because we know that a high portion of people with type 2 diabetes will have overweight and obesity, for example. So are there kind of other measures that might be good proxies until we have a robust surveillance system in place, for example? And that's part of the Roots framework. As I said, obesity monitoring and surveillance is one of the O's, because we know that data is everything, but data isn't always the easiest thing. You need to build a surveillance system. And part of that's partly why I also emphasize, if it's understood as a disease, then you need to be measuring it as a disease. So, but underreporting kind of really varies. We try to use, again, as I said, I think one of the reasons we try to use measured data, not self-reporting, because we see that as the best form of reliable data. And that's obviously one way around it as well. in some places we can't, and we have to use just estimates extrapolating from other countries. I hope I got that.
Unfortunately, Joanna, there are lots of questions that
Okay.
I'm not sure I'll be able to even put in my own personal questions, but I think it's better I take most of the questions from the audience. So
Sure.
there's a follow-up question to the one you just took, and the person is explaining, I meant, for instance, for places in the global south, for instance, Tanzania has not reported death since last April. So how can we make these connections and help people there? I think the question is about places where the latest data are not available. How can and we have to be able to still draw connection between obesity and COVID-19. So when data is not available, how can reporters report on that country?
Well, I think that is where a little bit of peer pressure of countries around Tanzania can be helpful, that if there's a similar profile, if the population is similar. So I'm assuming that the Kenyan numbers might be helpful there to place pressure on, I mean, I'm thinking place pressure on government and on donors and on WHO to acknowledge that obesity and overweight and obesity in Tanzania should be addressed if we want to be certainly preventing the next pandemic and while managing this one. And I think there's a lot we'll find out about there's a lot we are finding out about the weaknesses in our health systems and our monitoring and surveillance because of COVID that will extend to not understanding the burden of obesity in many countries. I think we'll understand it's much higher than we even thought once we are out of the crisis of COVID, and that's going to take a good long time, and able to look at what worked and what really didn't work. And I think a lot of health system surveillance didn't work, and that's unfortunate. But that's where you can use a little bit of peer pressure or comparisons by countries that are similar and nearby, I would say.
Yeah, so Sharon wants to know whether you mentioned that obesity is a gendered issue. Sharon would like an elaboration on that.
So I would say it's in some places. So in the Gulf, for example, you have a culture where people don't go outside that much. I mean, if you've been to Gulf countries, you know that it's as much as 30, 40, 50 degrees often, and there's not sidewalks and things. But that's unfair because that's changing too. But it's much more typical for women to be stuck at home and with limited opportunities to move and to be outside, and also a culture actually of hospitality around food that can contribute to carrying a lot of extra weight. So that's one way. So women not being sort of having the opportunities to be out and about in some countries, and in others, it is that sense of one of our, for World Obesity Day, we had people from all over the world advise us on our imagery, and one of my colleagues from Kenya who works in the Heart Foundation said, if you go to a wedding and the woman isn't plump, everybody, the bride isn't plump, everybody will say to the man, you need to fatten her up to show that you're successful. There's cultural issues like that are sort of gendered in that sense. But it does have to do both with staying home and having very limited access to physical activity, and then also the sort of the weight gain that is associated with pregnancy, and having an obesity problem before pregnancy, or having a weight problem before pregnancy can often turn into having an obesity problem after you've had 1 or 2 or 3 pregnancies, and that just doesn't, that cycle begins and is very hard to get out of.
And yes, the issue of the gender connection between obesity and is not something that is just peculiar to one country, and I think it's something that is being practiced in many countries, especially in Africa, and maybe there are experiences elsewhere too. And which brings me to the issue of there are some drivers of obesity that are strong, really strong, and very few individuals or organizations or governments are willing to take them on. Let me give you a quick background. In a country like in South Africa seems to be one of the very few countries in Africa with a major sugar tax. And
Mhm.
and when they do in the dialogues that led up to the introduction of the policy of the law, we saw the sugar players, the beverage industries threatening
Yeah.
citizens that tens of thousands of jobs will be lost. I don't think
Um,
any political leader would want to take that gamble. And so when we have that threat to the political ambition of visionary leaders, and coupled with the fact that there are some cultural elements that ensures that obesity is deeply rooted in the practice and daily lives of the people. So how does a particular journalist that is interested in reporting this issue go about trying to look at it from the solutions perspective, especially when there seems to be a reluctance to try something else?
I think it's a very, it's actually a little bit scary how some companies, and not all, a lot of companies are trying to do the right thing, partly because it's good for business to have a healthy population that stays alive so you can continue, but there are companies and there are parts of companies that have very, very, very harmful practices and place pressure on governments. We've seen it in, yes, South Africa. It's happened in many countries where this sort of, we will build you a big new plant and guarantee you employment if you back off from taxing sugar sweetened beverages. It's really unfortunate because the answer lies in our hands, which is if we could think of ourselves as sort of people centered and what's healthy for people, you can sell them tasty products. They just don't have to be so unhealthy. That actually is a possibility. But it's this kind of near termism that happens, and it's very, very, very distressing. So it's hard to get government to partner and agree to sugar sweetened beverage tax. However, I actually think that the momentum is really strong for SSB taxes. I think the way it happened in Mexico City was pulling together a very strong civil society coalition. So there was a lot of barriers in Mexico, in Mexico in general, in Mexico City in particular, to getting the SSB tax approved. But once this civil society voice just kept growing and growing and having very, very powerful messages that particularly address the audience, really wonderful billboards showing people as parents. I mean, I think we would all do, for ourselves, we may not take care of ourselves, but we will always take care of our children. That in particular was one of several factors that made them have a very successful campaign that led to sort of more federal success in the campaign. And then that became a model for other countries. So I think we need to acknowledge that, but to understand that, yes, the force of the potential influence of companies on governments can make it very hard to get those taxes in place, but it's not impossible at all.
Okay, now, so we are back to connecting COVID-19 with obesity. Chidindu Madu Okoli is asking, can we say that the lockdown as a whole, can we say the lockdown is a sole factor that contributed to the increasing cases of people living with obesity during COVID-19? And in preparing for epidemics subsequently, what factors do you think we can put in place to solve for physical inactivity during quarantine, especially for older adults?
Yeah. No, I think lockdown was absolutely not the only reason. So, I mean, there's two things. So there's the people who already had overweight and obesity before COVID happened. They immediately got sick. If they were exposed to COVID, they got much sicker than the average person. So there's that. And that is something that, their obesity certainly was driven by things like physical inactivity, but that's a separate issue. But the increase in weight was not just, certainly wasn't just because of physical inactivity. I think more than anything, it was physical inactivity plus unhealthy foods. And some of that was passive. There was less availability of different kinds of food. I think we've all experienced that during lockdown. But some of it was active in terms of the aggressive marketing. I mean, even in the US where I'm currently based, there was, Krispy Kreme. There was a donut company that I actually think in probably had some good intention on some level of saying, we're going to give free donuts to people who have gotten their vaccine. But it just doesn't quite, and I think eventually there was an uproar and they backed down, which is also shows us how important it is to report well on these stories. But I think in terms of the preparedness question, we need comprehensive national plans to address overweight and obesity. We need obesity to be understood in the health system. So when somebody has overweight or obesity, they can get treatment and not wait until they develop a comorbidity like diabetes or cancer. I mean, there are things that we need that can help very much reduce the number of people who had to get severely ill and die. We can't stopping obesity won't prevent the next epidemic, but it'll certainly prevent a lot of mortality from it.
Yes. Oh, yes. So we have a question from David, a journalist from Czechia, and he writes, Czechia is one of the countries you listed on the bad side of the COVID list. So his question has to do with the pandemic. So he writes, as we saw the COVID situation over there, the topic were not about the obesity, but more about the wrong decisions of the government. Do you think there is a strong connection between the obesity rate and the death rate, even in Czechia, or there could have been some other casualties that caused the high death toll?
Right. Well, so I mean, there's two ways I'm going to answer that. So first of all, we're not saying that obesity caused the death. It might have been that we'll do more research and we'll find out it was everybody who had severe obesity had diabetes. And actually, what we know is that, like age, obesity is a very good way of predicting COVID death, if that makes sense. It doesn't necessarily, it's just a correlation. We don't know exactly why, and we're going to find out more. There may be some other element, but so that's part of it. But if you want to predict who is going to die or who is going to have high death rates, look at the obesity rate. I think that's one of the takeaways, and that should at least be a guide. In terms of what other causalities, I absolutely think there's a lot about this is only conjecture because we don't know, but why, but certainly that's why I put up the slides of New Zealand, Cuba, and Iceland, smaller countries where there's probably more just inherently you listen to what the government does and you can control the borders. They did better, so that tells you that ability to actually control borders is important. And certainly countries where there had been that lived experience, which of a previous SARS, which would be many countries in Asia, there was also people remembered what the earlier SARS was like, and at the highest levels, the decision makers, the policymakers, everybody remembered and knew that it was helpful. So I think there's that lived experience, and then those all sort of translate into is it a country where you tend to listen to policymakers and follow the rules too? I think that probably plays a role. Oops, I lost you there, Paul. Not sure what happened there.
No,
okay.
I'm here.
Okay.
Yeah,
Okay.
So
I was going to answer the questions myself if I needed to. I can. They're right here.
No, I'm here. One thing that I think I've personally experienced while trying to report on COVID obesity is the difference in terms of local measures towards addressing the issue of obesity. I stay in Nigeria, and while I was doing a story on COVID-19, I interviewed a person that heads the Obesity Society. And so the focus for them is they are just starting and they are looking at how they can educate healthcare professionals. Now, even the healthcare professionals themselves have poor understanding of how to handle obesity, especially when it comes in the light of comorbidities. They instead choose to focus on the comorbidities and treat the obesity itself. Now, looking at these, the fact that not every country is at the same level in terms of fighting obesity. So what do you think can be achieved across board? And what do you think, irrespective of the state that a particular country is in its fight against COVID-19, it can also quickly catch on?
Well, it's a great question. So I think it's interesting. I think I mentioned last time we're in the early stages of a new coalition with the World Health Organization and UNICEF. And we're broadly prioritizing 3 areas. And one is just what you described. It's actually obesity prevention and management in primary care, but really trying to say this is, you need to have a way of, primary care needs to understand that obesity requires attention, just as you would address diabetes. So that's one way. And I think ideally, if you had obesity in medical education and in medical school education, that would help. The second is there's so much we can do on the regulatory environment, which is changing the obesogenic environment. So that is things like tax and labeling. And so those are things that every country can do. And that helps. And then the third is, interestingly, changing the narrative. I think changing the narrative to how we talk about obesity, how we report on obesity, not using stigmatizing words and images helps, because then you take away this shame and blame piece, which is not only not helpful, but actually harms people and isn't accurate. It's based on the wrong information, that somehow the individual is entirely to blame for their excess and unhealthy weight. So I think even those 3 things, it's narrative, regulatory environment, and obesity in primary care and more broadly in the health system are things that every country can do. And you don't need to be a doctor or a specialist to do them all. And that's really important.
Then still on the issue of what local actions, is there a way to actually access and grade what individual country is doing, and what is going to be the standard, the gold standard, if such exists?
Well, so in our report called Missing the Targets in 2020, which is on our website, that's, again, every country, technically every member state had signed on saying they were going to they were going to keep obesity prevalence, not rising, starting in sort of 2013, and end malnutrition. And no country is anywhere near that target, but those report cards lists a lot of factors of what could be driving it. It shows how much fresh fruit production there is at consumption, vegetable consumption, soda consumption. Do they have taxes in place? Do they recognize obesity as a disease and therefore, at least start to look at it in the health system? All of those things we see as what needs to happen. So we do have these report cards, which I hope that you can all use. They're free. They're on our website, that can really kind of tell that story a little bit better and show these are really the ingredients that are going to contribute to addressing unhealthy weight.
Then there is a thin line between, for journalists that are trying to report on obesity, which is, how do we report that this is a crisis? How do we report that there are things that individuals can do to reduce their risk of having obesity without stigmatization?
Yeah.
So,
well, there's.
Do you have an approach to it?
Yeah, absolutely. So I want to call out. We have the World Obesity Federation has for reporting. We have an image bank of pictures of lots of different ethnicities. Where people look, are carrying excess weight, but look happy and are very respectful. So using our image bank, we also have colleagues at the European Association for the Study of Obesity and other places who also have image banks. And so those pictures exist. So that's one thing, is use the good pictures. We always ask the journalists to. And then use the language. And we have guidelines on language, which come from our colleagues at Obesity Action Coalition, on the right language to use to describe people respectfully. So that's just a first there. In terms of, I'm sorry, the first part of your question, I've completely forgotten. I just answered the second part of your question and forgot the first part. Sorry. What was it? Yeah.
Okay. The answer you are giving me is also leading me to another question, which is what are the major wrong languages that you think journalists are always using that is wrong while reporting COVID-19? So if you can just give us a few examples of this before we go back to how to report COVID-19,
okay.
to describe it as a problem, but without stigmatizing the patient.
Well, yeah, I think it's it's also saying he's, this person, you'd say he's not an obese person, you say he has obesity. You don't say he's, it's all his fault, he's blaming the individual for it, or it's all the parents' fault. Can't they stop? They're weak. They're weak is one of the big ones, that they're weak. They have no willpower. If obesity has increased by 300% in the last 40 years, it's not like people got 3 times as weak. You know what I mean? It's not like everybody suddenly became greedy. I think that's just another way of looking at it. And especially if childhood obesity has increased by tenfold, it's not like children became 10 times more greedy. There's something in their environment that's obviously changed. And that's a big part of it. So I think it's really moving from individual blame to not societal blame, but societal responsibility. It's a shared responsibility. I think that's the language to use. But again, try to avoid saying obese person and say person with obesity. It really helps to show that that person as having this, not being this, and that's really helpful. So, but your earlier question was about reporting on COVID and obesity. And I think what's been interesting about this is that because it takes a very long time for obesity and for other NCDs, other non-communicable diseases, to make you very sick and to kill you, it's been harder for them to get the attention that infectious disease has gotten, even though, and infectious disease should get the attention, it deserves it, but it's been harder to create a sense of urgency because it happens over a long time. And it happens much longer than people are elected officials are in office, so it's hard to get attention for it. However, what COVID has done is actually show, particularly in obesity, that this is something that usually is longstanding, but you will quickly die from if you have COVID. And that actually, so that kind of time frame is in a way why reporting on obesity and COVID is a really more attention-grabbing story, quite frankly, which then helps get more political attention for it and people taking it more seriously and thinking about it. I think hopefully that answers that question.
Oh yes, I think it does.
Yeah.
Then if oh okay. So, okay, this person was just greeting. I thought that was a question. And so back to my lines of question. When we look at the responses and in some local organizing groups that have spoken to, they said there is this overwhelming nature of what is expected to be done. For instance, they have to talk about politics, they have to talk or engage policymakers to make the right rules. They have to educate the general public. They have to talk about looking at this from a whole point of view. But when I visited your website to look at local organizations, local partners the organization is partnering with, in some countries, there are very, very few, just one. For instance, I think for Nigeria, we only have one organization that the Federation officially identifies with. Why is it as if there are not enough local partners to be the foot soldiers that would enable the desired goals that has been set, that the world has not been meeting, to be able to be achieved? There are many organizations that are involved in the fight against HIV. So how come is it that we only have like one organization per country that is officially recognized in combating obesity?
Well, and in some countries, there's no organization. I think it's because it goes back to, well, first of all, in some countries, it's the Heart Foundation that's doing it. Or, in South Africa, we have a South African Association for the Study of Obesity, but we also work with the South African Heart and Stroke Foundation because they understand, and as part of Heart and Stroke, that obesity is becoming almost what tobacco used to be in terms of driving a lot of heart disease. So it might not have obesity in the name. I think that's part of it, but lots of diabetes organizations, lots of heart organizations are very concerned about it. We believe that there's a real opportunity for national alliances around obesity that are, from pulling from different groups that are concerned about it. And I think the reason it's only now kind of coming up in terms of people's attention is is again that, it hadn't been taken seriously as a disease. It was seen as something that could just be solved by telling people to eat less, move more. And that turns out to not be true at all, that it's much more complex and needs a health systems approach as well as approaches in other areas. So, so I think it's a better environment for it. And I think it is partly convening other groups as well. And then finding strong people who can talk about it. Champions is always helpful. I know the person who founded the Nigerian Obesity Society has been living at an unhealthy weight herself. And she says it's hard to get people to pay attention to that. But she's very willing to talk about it. It's finding those champions and working with them. So
And then one of the things that I think one of the approaches you've already described as effective is the reformulation that would enable the beverage industries to avoid the sugar tax that will impose on them. Now we have even a lot of these major companies that are producing these sugar beverages are also having reformulated versions of their products, even though they are not aggressively marketing them and promoting them. But some consumers know the difference, even though we still believe that a zero sugar containing beverage product will not have the same concentration, but some customers still see the difference in the ways these particular products taste, and will still always prefer the sugar option. Do you think, what do you say to these reformulation technology? Do you think there's still room for improvement, or do you think people should, do you think they have to taste alike? And or do you think the industry, in terms of the technology and the approaches or suggestions that have been market, they're already good enough? I don't know whether you got my question.
Yeah, I think so. So a couple of things. It takes a while to change your taste. I was diagnosed with cancer, and I wound up changing my diet a lot after that because I started to read a lot more about it. And I missed my salty, fatty foods. But over time, I find that I think part of it is my tastes have changed. I also don't completely rule out, I think sometimes it's okay to have a snack. We want healthy diets, but it doesn't mean we have to, every single thing we eat all the time has to be healthy. I think so that's key. You can have a piece of cake. Sometimes that was my birthday yesterday, so I had cake, but so I think that's part of it, is it does take time to change tastes. I think that product reformulation is really important. And I think tastes generally have changed. Demand has changed a lot over the last 20 or so years in places where, places like so many places where you now have like vegan burgers and things like that wouldn't have been available 20 years ago, and people want that and like it, and understand that it matters. So I think it's possible to change, demand a bit as well for different types of foods. And I also think that continuing to encourage companies, and probably incentivizing companies, maybe with tax breaks and things, to invest more money into research on reformulation, can definitely continue to be positive as well.
No, as an expert in this field, that you know this industry inside out than many individuals, than many journalists. What aspect of the global fight against obesity, do you think remains underreported that journalists can still help put the searchlight on?
Well, I do think that this obesity and COVID relationship is still, although we've been really pleased with how much coverage it's got, it needs to, that and preparing for the next pandemic, which, we need to be unfortunately thinking about, is definitely needs more coverage. The other is just this whole idea of obesity in the health system, that we really need a lot of doctors and nurses and healthcare professionals. They have a lot of bias against the person with obesity. They don't understand it. They don't know much about it. So that's an interesting angle, I think. And if there were much better understanding of obesity in the health system, there would be much, much, much greater outcomes for people with obesity. So I think those are a couple of the stories. And the childhood obesity story is a really important one, because, you really can't argue that it's the fault of the child that they have obesity. I mean, anybody who says it is, people will then say, oh, it's the parents, but we know it's much more complex than that. So everybody wants what's best for our children. And I think the childhood obesity story is an incredibly important and powerful one. So I think there's lots of different, it's also, obesity is a very interesting topic because there's so much to it. And so hopefully that can, journalists can understand how it cuts across so many different areas and can be a really very interesting way of looking at different issues.
Then how is your federation, what arrangements or what kinds of assistance are you willing to provide to journalists that are interested in covering obesity?
We're very happy to talk to journalists. Just contact us, and I can even put my name in the chat. You're free to, I'll put my email address.
Somebody asked specifically for your email address. So let them have an email address that journalists can always send messages to in case they need anything from the Federation to guide their obesity reports.
Yes, I'll do also info at worldobesity. Well, what I'll do is I'm actually going to put you in touch with our comms person here too, so you can, because if you're a journalist, you'd want to reach her. Name is Ellie Needs. But feel free to contact us. We're happy to talk to journalists. We know what an important role you're playing in this, and are really happy to talk to you. So yeah.
Yeah, so we're already beyond
past time.
Past time. But as we conclude, what do you think the key message for an ideal story on obesity should be? And how do you think journalists that are interested in covering obesity can continue to be interested beyond COVID-19?
So I think it's that obesity everybody is vulnerable and everybody is part of the solution. I think that's one key message, because we did for World Obesity Day, our messaging was everybody needs everybody, because we all have a part to play in this. That's one main message, and it is a health challenge, and there are solutions inside and outside the health system.
Then are there any events that the organization or any platform or any forum that the Federation is putting together that I think can also be of benefit to our journalists?
Absolutely. So we actually had a webinar at the same time as this webinar. We run different meetings and webinars on our site. And so we would welcome you. I'm not sure, the next one might not be until later in May or June, but that's something that we really encourage you to come and listen and come to our website and explore it and sign up to receive information about our webinars and other information that's going on. And yeah, and to just to request to receive material. We have activities going on all the time, and then we also have wonderful member organizations all around the world who run their own events and webinars, and hopefully in-person meetings that could be of interest to the journalists as well. There's lots and lots going on, so we're very, very busy, and really want to hear from all of you.
So I really appreciate you, Johanna, for actually taking time out to honor our invitation and to be with us today. And so for everyone joining us on Facebook and on Zoom, I really want to thank you for joining us. And I hope this webinar helps inform you better on the topic of obesity and COVID-19, and importantly helps inspire potential new angles for stories. And if you're not a member of the ICFJ Global Health Crisis Reporting Forum yet, I encourage you to please find the group on Facebook. And for more information about this initiative, please visit www.icfj.org. And if you would like to access additional resources, journalism resources on COVID-19, please check out the International Journalist Network at www.ignet.org. And please, to every participant on this on this call. Please don't forget to fill out a survey that is coming to your inbox after this webinar. And the reason is that the ICFJ would love your feedback to improve programming for the series. I've really had an amazing time. I've been inspired, I've been enlightened, I've been educated, and also I've had my knowledge about obesity further expanded. So I really want to thank Johanna and everyone at the World Obesity Federation that played crucial role in ensuring that this actually came to life. So I say thank you, and we'll be back with you sooner or later for topical issues around these discussions, which I think would continue to happen. So I want to wish everybody a lovely day. Enjoy the rest of the day and have fun. So we are out in 5, 4, 3, 2, 1. So bye, everyone.
Bye-bye. Bye-bye. Thank you. Thank you so much.
Bye.